BTK inhibitors have revolutionized our treatment paradigm in CLL. The lead compound was Ibrutinib, a covalent inhibitor binding to cysteine 481 in the BTK molecule. Next-generation inhibitors such as Zanubrutinib and Acalabrutinib are better tolerated. Nevertheless, they bind to the very same cysteine in position 481. Therefore, it is not surprising that in the clinic, but also in the laboratory, resistance mechanisms have been identified, and they are mostly related to mutation of this cysteine or C in position 481 in the BTK molecule. The most prominent mutation is the C481S mutation, but there are other mutations around. Of note, also downstream signaling, the PLC gamma 2 molecule can become hyperreactive with regard to resistance mutations under treatment with covalent BTK inhibitors. Now, the next wave of development are the non-covalent BTK inhibitors, and Pirtobrutinib has just been FDA licensed in the setting of double-class exposed or refractory CLL patients. However, also under Pirtobrutinib treatment, other mutations in BTK can arise, for instance in position 474, 428 or 528. Importantly, these resistance mutations also may confer resistance to the covalent BTK inhibitors. So in other words, if you give a non-covalent BTK inhibitor first, the fear could be that this could make you also resistant to covalent inhibitors. Therefore, developing smart sequencing strategies is very important. Now, in the work on resistance mechanisms towards non-covalent inhibitors that we did, we developed a model system where we could induce specific mutations that confer resistance to covalent and non-covalent BTK inhibitors. Therefore, this is a valuable tool to study in particular these clinical sequencing questions that in clinical trials are difficult to address. Moreover, we could show that in contrast to Pirtobrutinib, the other non-covalent BTK inhibitor in development, Nemtabrutinib, did not induce any specific BTK mutation. Therefore, the broader kinase profile of Nemtabrutinib appears to prevent this very specific BTK-driven resistance mechanism. This work, also with regard to combinations of other inhibitors together with covalent and non-covalent inhibitors, BTK inhibitors, will probably pave the way forward to develop rational treatment designs for our clinical trials, therefore speeding up clinical development of these compounds and their combinations.